Welcome to the Board of Health meeting of August 17th, 2020. I'm Judy Giorgio, the health agent for the town of Chatham. Please note that this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30A, Section 18, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Chatham Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the number previously posted and on the screen. Call-in number is 1-508-945-4410, and the ID number is 666-894-218 pound. And I'll turn it over to Chairman John Beckley.
Thank you, Judy. First thing I'd like to do is call roll to establish which Board of Health members are present on the call. Dr. Ward.
Present.
Dr. Hanson.
Present.
Ron Broman. I don't hear from Ron. Ed Sheehan.
Yes.
And I'm on the call. So we have 4 members on the call, which gives us our quorum. Let's start. We have 5 items on the updated agenda. The first item is the continued sewer connection order hearing for Christine Plumer at 98 and 100 Oyster Pond Furlong. We have attorney Howard Cahoon on the call representing her request. Howard?
Good afternoon. Can you hear me?
Yes.
Okay. So do you want me to begin at this point? Is that right?
Yes, please do.
Yes. Okay. For the record, my name is Howard Cahoon. I'm an attorney with offices in Harwich. And this afternoon, I do represent Christine Plumer. She owns both properties at 98 and 100 Oyster Pond Furlong. Her father, Richard Johnson, passed away a year or so ago and left her, his sole heir, the ownership of the property that's closest to the water. These properties are really sort of a financial hardship for the Mrs. Plumer at this time. The carrying costs in terms of taxes are $22,000 a year. Insurance and maintenance and other things get it right up there. And Mrs. Plumer and her husband live in Colorado. The properties receive very minimal use. This year they were going to be rented, but because of the COVID virus, they only were able to have 3 weeks of rentals. So I think there's minimal use and therefore minimal adverse impact on the environment and on Oyster Pond. So added to those financial hardships, as well as the sewer hookup, which I tried to put forth in my written packet to the members, which shows some of Eldridge Engineering Thad's ideas as to the costs and the problems with hooking up. It's not your simple hookup. It's a 250-foot run along a single-lane driveway, which is an easement, which also carries the water to the property. So anyway, all these hardships and the carrying costs and everything, the result in having Mrs. Plumer put the property on the market. And so it's actively marketed at this point in time. And we're hopeful that it will sell. And as I think maybe you may know, the real estate market is quite active at this point in time. And we're looking for someone that will take over this property. And it's very probable that someone that would buy it might tear down a house or move another house and have different plans for the property. And so we'd like to have an extension until a new owner purchases the property and comes forth with plans if he wants to change things. And at that point in time, the sewer would be hooked up without a problem because it'd be money from the sale that would be used to accomplish that. And so we just think to do it, if we had to do it now, which would, as I say, be a hardship, it might have to be ripped up and done all over again. And it's just not a simple job. So that's our situation. We'd request a continuance, and I have tried to cover all the questions you might have, but if there is anything that I can answer, I'd be glad to do so.
Thank you for that. Board of Health member questions, comments?
Ed Sheehan.
Mm-hmm.
Hi, Ed.
I move to just table this until they get the findings that are necessary.
Mm-hmm. Mr. Cahoon,
Yes.
does the owner expect that she would be required to do the connection, or that she would sell the property with the understanding that the buying person would then do it?
Well, I believe that the regulations for sewer hookups and so forth by the town require that on sale, the property would have to be hooked up, period. As to who would pay, that would be worked out between the parties. And believe me, there wouldn't be a problem. If they required the seller to pay, we'd be able to use the sales proceeds if they required. I think that's something that's worked out between the parties, and it wouldn't be a problem because there'd be money available that was being used to purchase the property.
Okay, Judy, is that correct, that this house could not pass ownership without it being connected?
Correct. It's considered, it would be considered failed for the purposes of a real estate transfer.
Okay.
So it can't transfer unless it's upgraded or connected to the septic, connected to the sewer system.
Mr. Cahoon, has the seller lowered the price on this house at all to try and get it to move?
Not at the moment, but we're active and interested, and if that's going to make it work, I think we're going to do that. You know, as I've pointed out in my written words here, the taxes alone are $22,000 a year, and the insurance on both parcels are upwards of $10,000, and maintenance and everything else. I mean, these people have owned these properties, the father and the daughter, for 20 or 30 years, and it's been a great thing for them. But at this point in time, it doesn't work. He's deceased, obviously, and all her children are grown up and don't come back. Anyway, we're motivated, and
Okay.
we'll do what we can.
Are you getting much interest in the real estate?
I haven't talked with the real estate broker directly, and I didn't question my clients on that, but I think so.
Okay. It's certainly a beautiful spot.
It is. It is.
Other questions or comments from Board of Health members?
Yeah, this is Noble. Ed, what did you mean by tabling this? I didn't quite understand.
Tabling it because it isn't available. They're not prepared to do anything.
I think if I might, what we're asking for is that we be given an extension until a buyer is found and a sale is contemplated or accomplished.
I think we just take it off the table until they can come back and show us what they want to do.
Okay, what we'd have to do, though, is we'd have to put a motion on the table to approve the extension request until such time that the property is
I'll agree with that.
sold. Can we get a motion to that effect? Can somebody
I'll
make a
agree
motion?
to that.
Yeah, this is Noble, can I ask a question?
Sure. We're not going to vote yet. I just wanted to get a take.
Okay. But this minimal to no use. Now, attorney, do any of the family members or their friends or the owner, did they come and use the property at all?
This summer, there's been three 3 weeks of rental in one property, one of the houses. And I think that the Mrs. Plumer did come here earlier in the summer, but that's it.
And then, so this summer was an odd summer, but normally it would be rented the whole summer, I suppose. Like, for instance, next summer.
They would try to do that to, as I say, get the carrying costs and support the properties and so forth. But for their purposes, they've decided that they don't want to be landlords, and this isn't working for them, and they would like to sell the property, and it's marketed.
Yeah. And Judy, is there evidence of a failing system, an actively failing system, or not?
Not that I know of, no.
Okay, we don't have any report in hand documenting an active failure.
No, it's just been ordered to connect to sewer, so they.
Got it. Okay.
You know, and so for real estate purposes, it has to connect, and that's considered a failed.
Okay.
Yeah, this is Noble again. So let me ask Judy. So they received the letter January of 17. So if we go past the new year, it'll be into the 5th year since they were ordered to hook up. Does that time frame fall within something we've done before for a property that's changing hands or not being used much, or one of those things?
It's out there.
I don't know that we have done it formally, but there certainly are properties that have been ordered to connect that in the same time frame that have not connected yet. These people have been very upfront with us and have come back every year to request extensions for the past 3 years. So that's, I think, good of them, because they are trying to do the right thing. But we don't, I don't know that we've given anybody kind of an open-ended extension. I'd have to go back and look through our.
But
I think there are some, this is John, I think there's some unique aspects to this situation that are probably not common.
Hey, John.
Yes.
Yeah, it's Bob Duncanson. Just, I think maybe 2 things for the board to consider here. One is you could certainly grant a time extension, but as part of that, indicate that, once the property is sold, they have, say, 90 days or 120 days to connect up to the sewer, or to come back to the board with an alternative. As Attorney Cahoon said, if a buyer wants to do a demo rebuild, that should be taken into account, I think. And then the second thing, because obviously, the rental potential of the property going forward, you may want to consider that as part of approving an extension, that the property not be rented, say, next summer, unless it's connected up to the sewer, so that you don't run into the concern about, well, that, I hate to say it, provides some more impetus for the buyer, for the seller to find a buyer, but at the same time, you're getting the environmental protection that, the whole sewering project is designed to protect, or provide, that, these properties in these sensitive areas are not being utilized unless they're connected up to the sewer. So just a couple of ideas for the board to consider.
Thank you for that. They make sense.
If I may, this is Thad Eldridge.
Yes.
Both properties do have Title V septic systems. So we're not talking about old cesspools here. We are talking about post-78 Title V. So there's some treatment.
Okay.
And also there's a hand up. I don't know if anyone noticed, but Dave Plumer was looking to speak.
Okay.
Thank you.
Go ahead.
Yes, hi, this is Dave Plumer. Thank you for your time. My wife is currently traveling today and can't join this call, but we appreciate your consideration. Two things I wanted to mention. Since 2017, Chris's dad was in very serious health during 2017 and through 2018, dying in that year. We did, upon notice from the town, did contact and have invested in plans for the connection through Thad Eldridge's team, and was very, very helpful. There are several options. The direct cost options total between 60 and 70,000, not including the restoration of the property once it's dug up, which was part of the rationale that Howard explained. Given the new owners would likely change a few things, it would be helpful to do it right once, particularly as the connection would need to go along the easement driveway to the street, and it borders the wetlands there, which is the town's property, and has a connection needs to be done over or under the town culvert, which accepts both a natural river as well as the drainage basin at the top of the street of Oyster Pond. So we certainly want to respect the environment. The carrying costs on the property, including the taxes of $22,000, are nearly double that. Given we maintain it properly, it is essentially vacant. My wife only went to help to open it for the minimum rental. And to the point about rentals, we've been advised by our realtor to minimize the rentals. We want to keep it obviously for carrying cost offset, which is quite high. I am retired and on a fixed income. I simply cannot afford the cost of doing the connection at this point, but would look for the proceeds from the sale. So we are very motivated in that direction, working with a realtor. She's also advised that the property is better if it is not rented, but we like to leave that as our choice, so we could get some minimal offset, but also have the property available for sale. The other reason for proceeding as we are now to ask for your gracious extension is that once the work begins, if it were to begin today or next month or in 3 months' time, what we don't want to do is impact, since the only access to the property is through this long driveway, of having both that torn up as well as the yards and so forth, and moving into a buying situation. It might be a turnoff for the eventual buyer until they can get in and decide what they need to do with the property. So I appreciate your listening to our situation and the consideration.
Thank you. Any questions for Dave Plumer? Well, I'd like as the chair to get a motion on the table. I don't know what the other Board of Health members think about what Dr. Duncanson had suggested we consider, i.e. a proviso in the motion that the sewer connection be made within a certain period of time after closing, perhaps 120 days, and the prohibition of future rentals if the house remains unsold into next summer season. What do other Board of Health members think about those?
Ed Sheehan, I recommend we put this on the table and let them work it out and come back with the final decision.
But what do you mean by on the table, Ed? I'm not sure.
Well, they're ifing and they're going on round and round, and all they want to do is to get the property sold and make the answer to the system. The selection is their choice. It's not our choice.
No, but what they're looking for, Ed, is more time. What they're essentially asking us to do is to extend the time for them to make the connection until they can sell the property. That's what they're asking for.
I'm not happy to do it that way.
Okay. Other board members?
This is Noble. If the property sells, part of it would be that the hookup has to be carried out in a certain amount of time. Isn't it, Judy? Isn't it mandated in the sale?
We could make that a requirement that the connection be made within 6 months of the sale.
But if this property sells, the system fails, and then isn't there a time period in which it has to be redone?
Yeah, I'm sorry. Yes, it's 90 days from in our real estate regs. It's if it's considered failed, it should be connected within 90 days.
Okay, so
or they would have to get an extension from the Board of Health.
Right. So if the property sells, then there's a mandate to have it have the hookup done in 90 days.
Correct.
Yeah. Well, it seems to me that we have to put some kind of a time frame on it, and I'm thinking that that we grant an extension, but this was a 6 months extension. I know they want to probably be extended through the rental season, but I think this is an unusual case, and there's difference of opinion about what we should do. So I'm thinking maybe we should just extend it 6 months, and then come back and rediscuss it, and keep the conversation about it. Is this property going to sell and eventually be hooked up before the summer season starts, as kind of a compromise thing for us to do?
So that we can revisit this question before next summer.
Yes, and then we don't have to talk about taking away their rental income right now. We give them a definite time period. We're not kicking the can down the road a long way, which I think is Ed's concern. And it sort of keeps us closely watching the situation here.
So you would suggest that the board approve a motion to extend their compliance time until 6 months, another 6 months?
That's what I'm thinking. Does that sound reasonable?
That sounds reasonable to me. Any other board members want to comment on that? If not,
was that a motion, Noble?
No.
Okay, I'll put it. I could put it as a motion. I move that we give them an extension for 6 months, and then revisit the situation at that time.
Okay.
I'll second that.
We have a second. Now, before we vote on this, does anybody from the public wish to comment? Okay. Let's call the vote. When I call your name, please indicate
John,
whether you. Yes.
Can I just say one more thing? I just quickly looked at the sewer connection regs because I wasn't sure about that 90 days. It does say in our sewer connection regs that they shall be required to connect to the sewer within 30 days of transfer of property. So.
Okay. So to me, that means we have protection about the situation, and they can always come and ask for an extension or whatever.
Exactly. I just wanted to clarify that. It's not 90 days, it's 30 days.
I think Dave Plummer has his hand up.
Okay.
Yes.
Yes, go ahead.
Just a quick question for the 6 month extension. When does that take it until?
I would think 6 months from tonight.
So it would be
February.
mid-February.
Well, it's we do have plans for connection. Our issue is financial hardship, as well as the logistics of doing it once. So I'm not sure that helps our situation, but it's really to the decision of the board.
Yeah,
we may not find a buyer until that time. I'm not sure. Buyers are active in the fall. They're also active in the spring. I raised the concerns before, but
yeah, this is Noble. I guess my intention is that we're not taking away the opportunity for summer rental, but we're not postponing this a long period of time. We're just keeping a close eye on the situation, but and we would discuss again at that time, and that's all I'm saying we would do.
I mean, this is John. Our hope is that the property can sell. and everything will begin moving then. But if it continues to not sell, we have to be a little bit concerned about how much longer we can extend.
Correct me if I'm wrong, Mr. Chairman. This is Howard Cahoon again. As I understand the motion, you're going to continue for 6 months and would like a status update at that point in time, and you really haven't determined that what would happen at that point. It's entirely possible you might say, well, we'll give you another few months or something. Isn't that correct?
Yes.
Yeah, Noble, that was my intention of the motion.
This is Alan. Looking at the plans for connection to the sewer, they look pretty complex, and I don't think that that's something that could be handled in 30 days. I think it's going to be much more than that.
I think it would be.
Well, I think, let me just say that if we get to that point and we have a seller in hand, we're certainly going to be right on your doorstep to explain the situation. Thad's going to be on board to finalize things. We're going to get bids from various people, and we're going to accomplish this. We realize that if we get a seller, we're going to move quickly on it.
Right.
Excuse me, get a buyer. We will move quickly on this.
All right. Let's hope you get a buyer.
So you
If not,
need to take your vote now.
that's what I'm thinking. All right. So when I call your name, please indicate how you vote as the Board of Health member. Dr. Ward,
I vote in favor of the motion.
Dr. Hanson,
In favor of the motion?
Ed Sheehan,
Not in favor.
not in favor, and I vote in favor. So there's a 3-1 vote in favor of the motion. So that is our decision for tonight and for the next 6 months. Thank you, everyone, for your participation.
Thank you, Mr. Chairman. Thank you, board members.
You're welcome. All right, let's move on to item number 2 on the agenda, a variance hearing for Martin and Colleen Berkhofer at 112 Skyway. And representing, this is East Southeast LLC. Is that you, Thad?
That's me. How are you,
Okay.
Thad Aldridge?
Okay, Thad, you have the floor.
Thank you. So the Berkhofers are looking to renovate their home. They're looking to add a second story over the garage and put a little addition out the back. Sewer work has commenced and is more or less completed out in the street, but the sewer is not yet available for connection. Their proposed addition will put their septic tank within 5 feet of the building, and we're also requesting an additional bedroom. We're requesting a little relief so that they can do this work without moving the septic tank and without installing the innovative alternative septic system, with the provision that they are planning to connect to the sewer as soon as it's available. If there are any questions, I'd be very happy to answer them.
Any questions from board members to Thad? Thad, is there any potential, there's no potential problem with the septic tank being closer to the foundation, is there? Because it's watertight.
The only concern that we have is when it actually gets removed, that septic tank is below the foundation. It gravities out from under the slab. So they'll just have to take care when they abandon it that they don't collapse anything in, but they can dig up to the edge of the foundation as long as they're a little careful.
Okay.
So even if it leaks, only if it overtops will it start to head towards that foundation, and the chances of that are pretty low.
Dr. Duncanson, is there any reason to think that this pump station could get delayed for a long time?
No, they're still working on the pump station through the summer. As you can imagine, things are a little slower in the summer than they are just with traffic and everything else. But this contract runs until next spring, but we expect the pump station will probably be complete and operational before that. But I can't give you a definitive date right now, but within a year.
Okay. Well, I'm personally fine with this. I don't know, other board members want to weigh in, maybe with a different opinion.
Okay, this is Noble. I just had a question. Judy's note says the existing septic system was designed to include a fourth bedroom. So the request to avoid the IA system is because the rules have changed since that septic system was in place. Is that correct?
Correct. Correct. You passed a regulation a number of years ago, 04, 05, that you can't reserve bedrooms in a septic system.
Oh,
So
Right.
any septic that was over-designed back in the day with the idea of adding a bedroom in the future, that's now, that you can't add that additional bedroom unless you have the land area or put in the IA system.
or put in the ice.
Right.
Well, which would make no sense in this case with the,
Right. And if we put in the IA system, then they get 10 years of use out of it, still nitrogen going into the environment. We do have the sewer connection plan ready. It's just waiting to file until the sewer is open for business.
okay.
This is Judy. I would just recommend that the system is inspected as part of this approval. I don't know if anybody has looked at the system recently,
Yeah.
because you are technically adding flow to the existing system, so it should be inspected as part of the approval for the addition.
I'm just looking up when it last transferred because they've owned it a few years.
It would take several months to build this addition, right?
Yes, it will. And it's also a seasonally used home.
Okay. I mean, it's possible that the addition will be done right around the time that the sewer is ready to be hooked up.
That's the hope. If Dr. Bob can get the crews working quicker, then we'd be happy.
Well, Thad, if you already have the sewer plan ready to go,
Yeah.
I would suggest go ahead and get it submitted. Don't wait to submit the plan.
Okay. We also have, the last transfer was in 2017, December of 17. So there should be an inspection from that date that we should be able to rely on, or is that too old, Judy?
I'm sorry, when was the inspection from?
The last sale date was December of 17.
I'd have to look at it. Because I didn't get to look at that in the file.
Okay.
I would prefer an updated inspection.
You got it. And we can file the sewer connection this week, so it'll be good.
All right. Can we get other board members okay with this? We want to get a motion?
I'll make a motion, Alan. I move that we accept this request, that they get permission to construct the fourth bedroom, that the variance for the septic system to be 5 feet from the proposed foundation, and that the first bullet, I guess that's automatic, and with the provisions that the existing system should be inspected and pumped if necessary. The property would be limited to 4 bedrooms. The engineer would submit an engineered as-built plan, and the property would be connected with town sewer within 180 days of being ordered.
Very good. Can I get
That Eldridge again, the as-built plan's really unnecessary. The site plan we've submitted actually shows the septic.
Okay.
I think I usually ask for that so I can see the elevations of everything when it's connected.
Okay.
So is that clear, Diane?
All set.
Can I get a second on the motion?
This Noble, I'll second it.
Okay, anybody want to comment on this before the Board of Health votes? Hearing none, let's call the question. When I call your name, please indicate how you vote on the motion. Dr. Ward,
In favor.
Dr. Hanson,
In favor?
Ed Sheehan,
In favor.
and John Beckley. I vote in favor. So it's 4-0. The motion carries. Okay, Thad,
Thank you.
you're welcome. All right, let's move on. Let's go to item 3 on the agenda, which is a variance hearing and approval of IA Technology for Gerald Evans at 2 Pondview Avenue, East Southeast LLC. So that would be Thad Eldridge again. Thad?
And here I am, for the record, Thad Eldridge. Somewhat similar situation. Mr. Evans, who lives alone in his 2-bedroom home. He's looking to put in a garage on his property with an affordable dwelling unit apartment above. He's got a septic system that can handle substantially more flow than his 2-bedroom and his current living situation. He is planning on tying into the sewer when it becomes available, and this is further out than the previous. But he is requesting to waive the need to connect or to upgrade to an IA and add the additional bedroom to his property, with the understanding he'll connect to the sewer as soon as it's available. And if there are any questions, I'd be happy to answer them.
Yep, Thad, it's Alan. I guess the whole thing is unclear from the beginning. So this is the existing house will continue to remain, but there's a garage then with an apartment above it. That's the story?
That's the proposal.
Okay, because it certainly wasn't clear from. So, thank you.
Well,
Sure.
I'm just concerned about the 5 years. This is getting a little bit out there. And Dr. Duncanson, this sewer
Yes,
project in this location on Pondview Lane. This says, Judy's memo says available in the next 5 years. Can you comment on that at all?
yeah, Judy and I talked about this one. We have been working, we have a design for this area. And we've been in talks with the folks in the condo association immediately to the east about the potential of locating a wastewater pump station on their property. We have not finalized those discussions or gotten an easement yet. So I was just trying to think, given where we are and how long it would take to sewer the area, construct the pump station, and all that. My best guess is within 5 years. It may be less than 5 years. It may be 2 years. It might be 3, 4. So, 5 was kind of the outside, given the area that we're talking about.
Mm-hmm.
If we can't put the pump station on the condo property, then potentially this entire area would be low pressure sewer. Because there really is no other good place to site a wastewater pump station.
What are the implications of that?
That would just mean that instead of the neighborhood having gravity sewer, everybody would have to have a grinder pump. Construction might actually be a little bit quicker because low pressure Sewer is generally smaller diameter pipe, and it's laid at a shallower depth, so it generally tends to go a little bit quicker from the public construction and the roads and whatnot. But it does require that each individual home have a grinder pump.
Okay.
So our preference is always, to do gravity whenever we can, even though it's maybe a little bit more disruptive on the front end. Obviously gravity sewers are easier on the homeowners because they don't have to worry about, grinder pumps and power outages and all those kinds of things. But
you
it's
need
a
a
little
pump.
bit more work on our side to get the pump stations located.
Gotcha. Okay. I don't know. I'd like to hear more Board of Health member just weigh in on are you comfortable with this?
Yeah, this is Noble. Yeah, a best guess 5 years. I kind of feel like you do, John. That's a little out there. But I don't have the experience. I've only been on the board for a little more than 6 months about what we've done in the past. The other question I had maybe for Bob was, my recollection is when they passed the ADU law, if this comes under the strict ADU law, I thought one of the things was you couldn't build the ADU and have a variance to Title V or to the septic rules. So that was part of the proposal as a safeguard. But I don't have that writing of that anywhere.
I don't have it right in front of me, but we could certainly double check on that for you because I know that was part of the discussion.
Yeah, and I thought that was a safeguard for. I'm for ADUs and I'd be sympathetic. But I thought that was one of the safeguards that was written down for people to have the measure pass. Variances to Title V. So maybe if we don't know that, we need to just put this off for another week or something.
That's a very, very good point, actually.
And if I may, with that Aldridge again, condition F, the Board of Health must have documented to the building commissioner that sewage disposal will be satisfactorily provided for in accordance with the provisions of Title V and local Board of Health regulations, including provisions for an appropriate reserve area on the site. The principal dwelling unit and accessory dwelling unit shall meet all wastewater requirements for the combined number of bedrooms / wastewater flow on the lot.
Thad, are you reading from the town?
Yes, that's right from the protective bylaw.
Yeah. Well, I would say that may be. I feel comfortable if we gave Bob a chance to actually review that and be sure we know what we're doing. The board,
Okay.
But I'm interested in what other people think as well.
So if Dr. Duncanson were to review this and come back and say that this would comply with that requirement, that then you'd be willing to consider this?
Consider it, yeah, but I still, like you, I think 5 years at best guess before it's hooked up. I just wonder about the precedent, and we're going to have a whole bunch of these things, and if we get in the habit of just saying, well, we'll just, wait until it hooks up, that's a little loose.
Yep. Dad, what would it cost for a property in this instance, 2 to 3 bedroom, to put in an IA system?
You'd be popping the septic tank, putting in a new one. A microfast is generally $8,000 to $10,000, and then you'd be looking at $1,000 to $1,500 a year for operation, maintenance, and electricity use.
Okay. So what would board members like to do? You want to put this on a continuance?
This is Noble. I'm thinking that we just put it off till our next meeting, and then give Bob a chance to give us an opinion. But I would say I'd still feel a little uncomfortable. But
yeah,
we need to know that anyway.
Maybe it gives us more time to think about it too.
That's right. I think that I'm kind of feeling that way. I'm sympathetic to ADUs, and I think, if that's what it really is, I mean, that's good. We just have to be a little thoughtful.
Yeah, it's John, it's Bob.
Yes.
Yeah, if you were to put it off until your next meeting, that'll also give me a little bit of time to confer with our engineers and maybe get a better tight time frame for you. That area as to how long, if we were to get the easement, how long would construction take and, whatnot. So I might be able to narrow that 5 years down to something, more tight.
Okay, that would be actually helpful.
Welcome to the audio conferencing center.
Okay.
Okay. Noble, why don't you make a motion that we carry this request until our next regularly scheduled Board of Health meeting?
Yeah, this is Noble. I make a motion that we carry this request until our next regularly scheduled Board of Health meeting.
Judy, is that an okay worded motion?
Yes, I believe that's fine.
Alan, I'll second it.
We have a second. Anybody from the public or wish to comment on this before the board votes? Okay, I'll call the question. How do you vote on the motion, Dr. Ward?
In favor.
Dr. Hanson?
In favor?
Ed Sheehan?
Yes.
And myself, I vote in favor. So we have 4-0 to vote to carry this issue forward until our next regularly scheduled Board of Health meeting.
Correct.
At which time we will get additional input of information from Dr. Duncanson, and then we can consider it further at that time. Okay, that's a good solution for this right now. Okay.
Have a good afternoon, all.
Pardon me?
Have a good afternoon.
Oh, you too, Thad.
Thank you.
Item 4, a discussion regarding removal Board of Health swimming restriction at Andrew Harding's Beach. Judy, you want to report on that?
Sure. We have, I believe Stuart, the harbor master, is on the line as well. He had brought up to us that the area is not as treacherous as it was when the Board of Health originally banned swimming there, because of the changes in the harbor there. So we thought we should bring it up for discussion again. Stuart, if you're on the line, would you like to weigh in on this?
Sure. Thanks, Judy. I just thought it was time that maybe we had a discussion about this and discuss the value of keeping the prohibition on swimming at Andrew Harding's beach. As many of you are aware, it's a popular place. It is regularly and routinely used for swimming, even though it's technically a non-swimming area. It kind of confuses some of the issues because technically we should be not allowing swimming there when we get boats and swimmers in conflict, but we still have this prohibition. And given that the inlet, the bar has moved to the south considerably, it used to be when you parked at the lighthouse overlook, you would look out and see the open ocean instead of the beach. Well, that beach is now pretty far south, and the conditions, not only at Andrew Harding's lane, but Lighthouse Beach as well, that existed years ago with heavy surf and strong currents and undertows don't exist to that extent. And I thought it was a good idea to bring it up for discussion, whether the board wanted to reconsider the prohibition.
What year was this is John Beckley, what year was the prohibition put in?
It's been some time, John. It's probably, trying to think, it's all of 10 years now.
Oh my goodness.
I believe.
Really?
And I know we have a lot of prohibitions on different things around town that aren't enforced, but this one, there's no town presence there, so it's obviously not enforced. And, but more importantly, the conditions just are entirely different.
So what would happen if the prohibition was lifted?
I'm not sure much of anything would happen other than people would not be swimming in technical violation of your order,
But
which is happening.
Would the town rescue people have to be down there then? Would there be more signage and more lifeguard work or not?
Well, the lifeguards don't cover that area now. They
Okay.
only cover Lighthouse Beach proper.
Okay.
So I don't really envision anything really changing other than we wouldn't be faced with this kind of blatant, unintentional violation of your order.
Right.
Yeah, John, it's Bob.
Go ahead, Bob.
Yeah, I was just going to add to what Stuart said. The area there at Andrew Harding's Lane has always been what we consider a rural beach or a neighborhood beach, and it's similar to areas like Pleasant Street, Forest Beach, and some of the others where we don't actively provide lifeguard services.
Okay.
So from that respect, it really wouldn't be any different than those other rural beaches that we have. And Stuart's right. I was actually just trying to look it up. It's been at least 10 years and maybe longer since it was posted. And just to give you a sense, and you're probably familiar with the fact that we did a study last year on our our east-facing shoreline by Applied Coastal Research and Engineering, and as part of our CZM grant. And a couple of things they did was they looked at the bathymetry of the Chatham Harbor area. So in other words, how deep the water was, as well as the tidal currents, because the two reasons why the board originally put that ban into effect was, one, there was a fairly steep drop off in that area because of the way the currents were running when the inlet was much closer to that area. And it went from practically dry beach to 60 feet deep, and so they were concerned about that. In addition to that, the speed of the currents in the area has dropped significantly as the inlet has moved to the south. And I pulled up one of the tables in the last year's CZM report, and at Watch Hill, which is just immediately north of there, which is the area that kind of sticks out that's revetted. There's been between a 67 and a 77% difference, a decrease in the speed of the currents through that area. And I think we've all kind of observed that as the inlet has moved south, and especially since the Fool's Cut and a greater majority of the tidal flow now goes south into Nantucket Sound. That area to the north up between, the Lighthouse Beach and, the new inlet at the north end, that area has become much more stable, much quieter. The current speeds have dropped significantly. So to see current speeds drop between 60 and 77%, that's significant.
Okay.
And in addition, the bathymetry in the area, and they do have one bathymetry in their report, and that area there right along the beachfront has shoaled in. There are still some deeper holes in the area, but right along the shoreline itself, it has gotten shallower. So the two reasons why the board put that ban into effect when they did originally have really mitigated over the years as the inlet has moved south.
Okay. This is very interesting. I didn't know any of the history of this personally. Other board members?
Yeah, this is Noble. What are the rules, Stu, at Lighthouse Beach in terms of swimming and lifeguards?
So there are a couple of, typically between 3 and sometimes 4 lifeguards down at Lighthouse Beach. They're roaming lifeguards in that it's not a posted lifeguard area, but the town does provide lifeguard coverage down there on some ATVs, and they have some surfboards if they need to get out into the water. But I was just talking with them, and indeed they continue to primarily are directly in front of the parking lot at Lighthouse Beach.
Mm-hmm.
Can you swim at Lighthouse Beach?
You can, yes. There's different flags they use to determine when days they allow it and when days they don't. So if the red flag is up, swimming has been prohibited for whatever reason. Maybe it's, weather conditions or something like that.
Yeah, John, it's Bob again.
Yes.
Yeah, just so the board's clear, the staff at Lighthouse Beach, while they are trained as lifeguards, they are there more as a beach patrol. They, as Stuart said, they do not sit in a tower. There is not a designated swimming area. So it's somewhat a swim at your own risk area. But we do have staff there that if you get in trouble, they can effect a rescue. They're also there keeping an eye on seals and the potential for great white sharks. So they do a lot of things, but they're not there strictly as lifeguards. So just so the board's clear, there really is a distinction between a lifeguard and a beach patrol.
Okay. So who has the authority to lift this? Is it a Board of Health issue? Is it a Recreation Department issue? Both?
No, it's Board of Health because it's your regulation. You put the regulation in effect that banned swimming in the Andrew Harding's Lane area.
And interestingly enough, and I believe this is still the case, unless there's information that I don't have, and that is Lighthouse Beach is a beach. It's a town beach, so it's under the jurisdiction of the Parks and Rec Commission. And Andrew Harding's Lane I don't think I'm not sure it was ever designated a beach. I think it's still under a town landing designation.
Okay.
Yeah, that's why I said it's really considered kind of a neighborhood beach because it is not a formal town beach.
Okay. So
this is Noble again. I tried to look this up, and there was a Cape Cod Times article in 2008 that talks about the closing of Lighthouse Beach. That was after the fellow was drowned there, I think. But that was done by the Parks and Recreation Commission. So I guess, Bob, are you certain that we are the ones that closed the beach, the Board of Health, and not Park and Recs? They're not involved with this?
Yeah, no, this was a Board of Health action.
This particular issue at Andrew Harding's was specifically a Board of Health order where, the Parks and Rec on one of their beaches could, for some reason, close to swimming as well. But this is under the Board of Selectmen, and it is indeed your order that created it at Andrew Harding's.
Okay, and then a question for Bob. Is there special signage at these rural beaches about swimming or not swimming that would have to then be posted at Andrew Harding's?
Actually, at Andrew Harding's, we would be taking down signage because there should still be. I believe it's still there. There was signage that indicated that no swimming was allowed due to the strong currents and the steep drop-off. There generally is not any specific signage at the other rural beaches, in terms of swimming at your own risk. That may be something the town wants to think about going forward. But in the past, there hasn't been anything.
Okay. Any other Board of Health members want to weigh in? Any questions or comments? It sounds, based upon what I've heard, that this would be a timely issue to act upon, given what we've just heard. But I just don't know what other board members think.
You want a motion, John?
Yeah, could we get a motion to, I guess it would be to lift the Board of Health swimming restrictions at Andrew Harding's Beach?
Alan, I'll make that motion that we lift the Board of Health restriction on swimming at Andrew Harding's Beach.
Do I have a second?
Second, Ed Sheehan.
We have a second from Ed. Any further discussion? Anybody from the public wish to comment before the Board of Health votes? All right, I'll call the question. When I call your name, please indicate how you vote on the motion before the board. Dr. Ward?
In favor.
Dr. Hanson?
In favor?
Ed Sheehan?
In favor.
And I vote in favor myself. So the motion passes 4-0, and the restriction has been lifted by the board, effective immediately.
Okay, we'll get any signage that may be down first thing tomorrow.
Thank you for your input, Mr. Smith.
Thank you.
Okay, that's it for item number 4. Let's go to the last item, which is an update and a discussion on COVID-19 with Dr. Duncanson.
Good afternoon, everybody. So, quick update on the numbers. Right now, worldwide, we are at 21.7 million cases, 776,000 deaths. In the U.S., we have 5.4 million cases, and we currently have a little over 170,000 deaths in the U.S. Massachusetts, the numbers are a little less clear than they've been in the past because starting last week, Massachusetts changed the way they report their cases. It used to be that on a daily basis, they provided both confirmed cases as well as probable cases, and they provided updates on a county by county basis. Starting last week, they stopped doing that, and they now just report confirmed cases every day, and they're only reporting probable cases once a week on Wednesdays. And they're not reporting county by county data anymore. So I can tell you that as of today, hang on a second, let me just pull it up. As of 4 o'clock this afternoon, we had 114,611 confirmed cases in Massachusetts. We were averaging about 7,000 or 8,000 probable cases. So that's why, up until last week, you were seeing numbers from us around 121, 122,000. And I expect that still to be about consistent. Massachusetts reported another 213 confirmed cases today and 4 more confirmed deaths. So right now, they're reporting 8,611 confirmed deaths in Massachusetts. Last week, we had about 222 probable case deaths. So we were around 8,800 or so. And I suspect we're probably still around there, but I won't be able to give you any update until Wednesday in terms of where we are with the probable cases. And the last information we had on Barnstable County, which was last week, was we were at 1,800 cases. I suspect we're probably, 50 or so cases more than that, given the number of cases we were averaging every day. But unfortunately, because of the way they're now reporting information, some of this information is going to be out of date fairly quickly by the time we do get it, now that we're only getting it once a week instead of every day. There hasn't been a whole lot of new information out of the state in terms of, changes in guidance or updates. As everybody knows, the new travel restriction went into effect August 1st, requiring everybody coming into Massachusetts to either self-quarantine or provide a negative PCR test result, taken within 72 hours. We are getting copied, or we have access to some of that information through the state's database. Judy and I looked at it on Friday, we had about 450 people that indicated that Chatham was their destination. Unfortunately, one of the pieces of information that was missing was where they were going to be located when they got to Chatham. We got information on their home address and the states where they were coming from. But so, that unfortunately makes it not that we were going to be doing any follow-up anyway, but if we got, a call from somebody saying, hey, there's people staying in the house next door to us, they have out-of-state plates, they're not self-quarantining or whatever. It wasn't, the idea was it was supposed to make it easier for us to then be able to access this state database and say, okay, those people all had negative test results or they're self-quarantining or whatever. Unfortunately, the data they provided didn't have that good information for us. So, some other towns have noticed that as well, and there's conversations with the state about hopefully maybe clarifying that so that we get the local address where these people are staying. Right now, we're not tracking any active cases in Chatham. Knock on wood, we kind of peaked at 23 known cases or reported cases to the state. And most of those, if not all of those, have now cleared. So we're not tracking any active cases at the moment, which is, good news.
Wonderful.
We've had our COVID-19 testing clinic related to the house party that took place in Chatham back in the beginning of July. That seems to have settled down. Harwich did a follow-up clinic. They tested 155 people. We haven't gotten any definitive word. We didn't get any new cases out of that for Chatham. So that's good news. So yeah, we're still working on updating the town office openings. We've received a significant portion, about half of the materials that we're waiting for from WB Mason to arrive. Came in last week. Our last word I'd gotten was the rest of the materials were supposed to ship over the weekend. So hopefully we'll see those this week. And then our intent is we would probably have a transitional period where we would make town offices available by appointment only. And then subsequent to that, we would go ahead and reopen town offices to the general public. More than likely not till after the end of the tourist season, if you will. Just to avoid having a lot of people stop in at the town office, who are just looking for a place to eat or looking for a bathroom, all those kinds of things, but really try to limit it to only people that need to come into town office to conduct business that they can't conduct in any other way, either virtually or by phone or by email, because as we've talked about before, we're doing a very good job really keeping everything going as far as town work is concerned and town offices, meeting the needs of the public. Really, the only place that we haven't fully restored yet to most functionality is the community center, just because, a lot of their programs require face-to-face contact.
Yep.
Even the Council on Aging has kind of reopened because most of their services they can do remotely as well. So they've been doing that. But the community center is a little bit harder to deal with. We are working right now with the staff at the community center as well as the folks at Monomoy Community Services to get an after-school daycare or after-school program up and operational, recognizing that the schools are going to start reopening in mid-September. And, in order for folks to go back to work, they need that kind of after-school care. So we're working with them right now to get that program up and running in a way that's compliant with all the various COVID-19 requirements related to, the number of students or the number of participants that can be in each group, which can't exceed 10 right now. So we're looking at, multiple cohorts going on at the same time, using the community center, keeping each cohort in one room per day and then kind of rotating around so that, they might be in the gym one day doing kind of things there. They might be outside one day as long as the weather's good. They'll be inside in a classroom or in a room doing, some kind of arts and crafts one day and things like that. And kind of rotating the youngsters around so that they get, a share of all those various things without having to move from classroom to classroom, the same day. And then all the classrooms or all the rooms that are used would be cleaned and sanitized at the end of each day. So we're looking to get all those things in place, in time for the school openings as well, recognizing that, parents need to get back to work and, they need to have that after school childcare. The schools have submitted their plan for reopening. In Chatham, grades kindergarten through 7 would be going to school every day because they do have enough space to be able to do that while social distancing. At the high school, the students would be attending in class some days and remotely other days because they don't have enough space at the high school to really spread everybody out and have everybody in school all day, every day. So they've come up with a plan. It's been submitted to the state. I reviewed it over the weekend, and it is compliant with all the COVID-19 requirements. So barring anything unfortunate, I think, they'll be good to go once they plan to reopen schools around the 14th of September. So with that, I think that's kind of a quick update on where we are with COVID in Chatham.
Very good. Any questions for Dr. Duncanson from Board of Health members?
This is Noble. Dr. Bob, has the town, do we know about any cases of people that had the virus in town but were residents in some other state, with their second home or rentals or something, that we would have to be, that information would have to come to us from other towns? Have we had any instances like that?
No, none that we're aware of.
Okay.
No, I mean, as we've talked in the past, I mean, that's one of the gaps in our information base is if somebody is COVID positive and they're not a Chatham resident, we wouldn't necessarily hear about it. If they're staying here, it would be reported to their home state and their home health department. But, unless they chose to reach out to us, we wouldn't hear about it.
Yeah, that is a weakness in the system. This is John.
Yeah.
Any other questions for Dr. Bob? I want to at least touch upon the ongoing surveillance at Schoolhouse Pond that we've been doing, at least some of us have been doing the last couple of weeks. And I've been by there 9 times between August 4th and August 12th at various times during the day, anytime between 1 and maybe 4 o'clock. And I have found, to my eye, that on those 9 visits, during 8 of them, everybody seemed to be social distancing very well. On one of the visits, I saw a couple of groups that I thought weren't quite far apart as they should have been. They weren't on top of each other, but they certainly weren't, 12 feet. Other than that, I think it's much better than it had been. The average number of cars that I saw parked in the lower lot by the pond was 8. And at the upper lot, the average number was 6, although there was a day when we had 14 cars up there. And then recently, the last few days, of course, it's been overcast or rainy, and very few people have been there. Any other Board of Health members want to comment on any surveillance that they have done or our continuing policy of trying to assure that facility is safe in terms of COVID? Anyone else?
This is Noble. Yeah, I've been there quite a few times. Again, it tends to be crowded about 3 o'clock. Most of the time, the distancing is safe. Occasionally, it's marginal. I think it's much improved. The big concrete blocks were a help. That seems to have cut down the parking on the grass. I believe that the Park and Recs might have a monitor there. I was told that
there is a young woman.
there's a person there until 4 that monitors and helps
Yes.
tell people not to park.
I've gotten to know her. She's very nice.
Right. And then I guess for Dr. Bob, is there signage that's going to go up in addition, or is it felt that the concrete blocks are enough of a solution to the parking?
I think there is going to be signage. Unfortunately, DPW's new sign machine was not able to get up and operational. So I believe they ordered some signs, but I will follow up with them and find out the status.
That would be the last piece of the puzzle, I think, Dr. Duncanson, if we could get
Yes.
some signage to just
Yeah.
finalize that
Yeah,
sign.
this is Noble. This is Noble. To my observation, that I think it's satisfactory control of the crowds for right now. You know, keep doing what we're doing.
Agreed. Anybody from the public want to comment on this topic before we move on? Okay. Any other Board of Health members want to comment on Schoolhouse Pond? All right. Let's move the agenda. Our last item is to review and approve the minutes of August 3rd. Everybody was sent a copy of those minutes. Does any board member have any edits or changes, corrections that they'd like to request be made? Not hearing any. Can I get a motion to approve the minutes of August 3rd?
Alan, move we approve the minutes.
Do I have a second?
Second, Ed Sheehan.
Ed? Okay. When I call your name, please indicate how you vote on the motion. Dr. Ward?
Approve.
Dr. Hanson?
Approve.
Ed Sheehan?
Approved.
And I vote to approve as well. So the minutes of August 3rd have been approved. Are there any other final comments or questions or issues anyone wants to make? If not, I'd like to have a motion to adjourn.
So move, Alan.
Have a second?
Second,
Ed?
Ed Sheehan.
Okay. All right, when I call your name, indicate how you would like to vote on the motion to adjourn. Dr. Ward?
Approve.
Dr. Hanson?
Approve.
Ed Sheehan?
Approve.
And I approve. So the meeting's been adjourned. Thank you, everyone, for showing up and doing your job. And thank you for the fine support we get every meeting from Dr. Bob and Judy. That's it for tonight. Thank you. Bye-bye.